I met Dr. Weaver at UTHealth. Dr. Weaver has helped me tremendously. He is a huge support system for my sobriety. He has, more than anything, focused more on my anxiety, and that was a really big trigger for my alcohol use.
My work at the Innovations Addiction Treatment Clinic at UTHealth involves helping patients with all forms of addiction to alcohol or drugs or combinations of those. With the COVID-19 pandemic and with social distancing in particular, people get more isolated. That tends to bring up depression and anxiety from what's going on in the country and in the world, and people may self-medicate with what they have at hand.
I really hit the lottery with him because not only does he know about addiction, but he, specializes in it and heads a team of people that are studying and researching addiction.
I worked with her to make her accountable for continuing other recovery activities, including things like attending 12-step meetings, as well as staying engaged with a therapist for individual counseling. And that's allowed her to maintain her long-term recovery.
Gratitude is a huge tool that I've learned to use to maintain, my mental health, which is important. If you can stop and name like 5 things that you're grateful for immediately, it will take you out of that cycle, and you start looking at things, you start seeing things from a different perspective, which is really the trick. UTHealth has really spent a lot of time putting together these teams of people who really attack the disease from all different angles. People researching 12-step programs, and people researching therapy, and people researching medication and early prevention, and all of these different things that need to happen to really even have like a tiny chance of curing the disease of addiction, which is, that's just amazing. There's still such a huge amount of stigma that surrounds the disease of addiction, and a lot of shame and a lot of guilt that comes along with it, not just for the people who are coming in, the addicts, but also all of the people in their lives. I think that the stigma goes away by putting faces and names to the problem.
The more other people can take heart and can recognize that they too can do something about it, and that addiction is treatable, and that they too can be successful at overcoming that.